My name is Christine Sisse.
I'm Mohammed Mustafa.
I'm Gayatri Vasudevan.
Mi nombre es Esteban Reyes.
I am Zubair Torwali. I am based in Pakistan.
My name is Niniola Williams, based here in Lagos, Nigeria. I'm also an Acumen West Africa Fellow.
My name is Kobana Hassan Mays.
Hello, I am Dilip Patubala, based out of Bangalore in India.
My name is Hitesh and I stay in Mumbai.
My name is Dr. Sara Singh Khurram. I'm based in Karachi, Pakistan, and I'm an Acumen Fellow 2016. We connect female doctors to patients who need healthcare using a telemedicine platform.
We help graduates upskill in their trainings.
Maka is a tech platform for non-literate gig workers.
We are focused on human rights, indigenous rights, their cultural rights, and their human rights.
We provide full farm management services to smallholder cocoa farmers.
So our mission is to see that people reach their potential and earn a good living.
Our work is really about how do we reduce infection and protect public health. As we, started hearing about COVID-19, we knew that it would eventually come here to West Africa and specifically to Nigeria.
There was this instant pause to everything.
This feels like deja vu for Sierra Leone because we've had Ebola.
Within the first 3 days, we realized there's a major crisis in place.
All our clinics had to shut down.
There was this real risk that we won't be able to pay salaries to our helpers. This was the most vulnerable segment of society.
We had to change our program because our program was classroom-based.
We are trying to work with vulnerable farmers, people who really depend solely on their farms for a living.
And that was the logic of how do you get over COVID is to make sure that we just survive.
The reason why we were founded was now so apparent. So how do we prepare the human beings that are going to be the ones on the front line?
Most of the funders either wanted to defer the payments for COVID to go away. And that's when we heard about Acumen Emergency Facility.
And this was literally our only hope.
So we had the expertise, but we just didn't have the means to make it happen. And so the Acumen Fund really just bridged that gap for us.
Nobody else matched the speed, the agility of Acumen in creating a fund and then actually dispersing it.
Mientras que los recursos que recibimos de Acumen tenían la posibilidad de ser usados en las cosas que son críticas y necesarias para hacer lo que nosotros ya sabemos hacer.
They asked us what we needed the money for, and they were flexible in providing us the funding for whichever need that we had.
The question was, how are you going to manage? Are your people safe? Is there anything we can do?
You can say it was like oxygen for our key staff to continue their work.
We were able to maintain our staffs. We also were able to keep all the doctors on the platform.
Let's cover our salaries. We've kept people in jobs.
It benefited over 2,000 people directly.
61 households continued to get a salary for 6 months during the lockdown.
It really cushioned me to be able to reach the farmers.
I think the whole Acumen group has been fabulous.
And it is a community who understands what you do. But I think Acumen makes these things feel normal, and I think it's amazing.
So what gives me hope or what keeps me going? It's just doing what's right, not what's easy.
Yeah, human rights work, it's a social justice work.
Just, being there for each other as a team really, really made a difference for us.
I choose to look at the brighter side of things for COVID, that it's made us more resilient.
We have corporations and coalitions and people coming together to respond in a way that I really haven't seen in my lifetime before. And it's just such a beautiful thing to see that we can do this. We do have the capacity to. And if we can do this in an emergency time, the hope is, of course, that we will continue to work in these ways beyond COVID.